Hello, my name is Emma Hunniford, and I am a senior athletic training student at Florida Gulf Coast University. And today I will be demonstrating how to conduct a SCAT5 concussion assessment. Hello. So right now we're on the field. The athlete just went down. This is the steps that I'd be taking when I first approached. So my step one, I'd be looking for red flags. So any neck pain or tenderness, double vision, weakness or tingling and burning in the arms and legs, severe or increasing headache, seizure, convulsion, loss of consciousness, deteriorating conscious state, vomiting, increasingly restless, agitated, or combative behaviors. So after that, obviously, he would not have any red flags at this moment, so I would go to observable signs that I can either observe on video or witness myself. So obviously when I approach them, if they're lying motionless on the playing surface, means that they're in and out of a concussive state. So I would obviously go back to my red flags and reassess those. I would look for any balance or gait difficulties, motoring coordination, stumbling, slow, labored movements, any disorientation or confusion, inability to respond appropriately to questions, a blank or vacant look, and facial injury after head trauma. So like any basal fractures or anything like that. Step 3, memory assessment Maddox questions. So first and foremost, I would ask them, or tell them that I'm going to ask them a few questions. So please listen carefully and give your best effort. So first, I would ask what happened.
I got tackled really hard. I don't remember that much.
Gotcha. So following that question, I would ask sport-specific questions in general, but I would ask, what venue are we at today?
Football.
Okay, football. What half is it?
I don't know.
Okay. Who scored in the last match? Or last in this match?
No.
What team did you play last week?
Naples.
Okay. Did your team win?
No.
All right. So again, if we were doing something like baseball, we wouldn't ask what half. We would ask what inning, stuff like that. So make sure that those are sport specific. Step 4, I would examine the Glasgow Coma Scale. So these would be the eye, motor, and verbal responses graded on a scale of 1 to 4. So I would look at any responses. So eye opening spontaneously, which is an R. So that'd be a 4. Verbal responses, he's effectively communicating with me, although he doesn't have a lot of memorization, doesn't mean that he's not effectively communicating. So I would rate that a 4 or 5, my bad, for verbal responses on a scale of 1 to 5. Best motor response would be on a scale of 1 to 6. So he's obeying my commands when I ask him the Maddox question, so I'd grade that a 6. So there's no worry about the Glasgow Coma Scale on this section. And we're going to C-spine that we would obviously be looking for in all of these first steps for the on-field assessment. But it's really important to note that if a patient is not lucid or fully conscious, that you should always suspect a cervical spine injury unless it's proven otherwise if he comes to. So always ask the patient who's feeling any pain or tenderness in the neck, which we did at the red flags for step 1. All right, so moving on to step 1 for off-field assessment. Basically, we're just going to dive into the athlete's background a little bit. I'm not going to go too in-depth with this because you can kind of guess what it would entail, but the super important stuff to hit would just be, so how many diagnosed concussions have you had in the past?
No, I don't think I've had any.
Gotcha. So when was the most recent concussion that you had, or you would ask if you had any previously? How long was his recovery? Any current medications that he'd be on? And then you dive more into if you've ever been hospitalized for a head injury, if he has ADD or ADHD, any learning disabilities, dyslexia, depression, anxiety, or other psychiatric disorders. So step 2, I would ask him to fill out this concussion symptom score sheet like this. I would not read these off to him. He would read the directions at the top and then fill them out himself. And then these scales can go from a scale of 0 to 6, and obviously 6 being very mild or none, and then 6 being severe. All right. So step 3, cognitive screening. We would start with orientation. So What month is it?
It is May.
Yeah. What is the date today?
30th.
Yep. What day of the week?
Do it with Thursday.
What year is it?
I know it's 2018.
What time is it?
Noon.
Sure. So orientation score would be out of 5. There's 5 questions that you ask them. So if they got all 5 right, you give them 5. If they got one wrong, you give them 4. So going off that. And then we test immediate memory. So you can do either a 5 or 10 word list and circle a specific one. The SCAT5 actually lists a few different lists that you can use. And so you can keep track of what words you do use. So we'll do a 5-word list. So remember these 5 words. I'm going to repeat them to you twice and then repeat them after, okay? Finger, penny, blanket, lemon, insects. And I'll say it one more time. Finger, penny, blanket, lemon, insects. Right.
Finger, penny, insect, blanket, pillow.
So like he demonstrated, he only got 4 out of the 5, so that would be a 4 out of 5 on the scale. And then you can do that more than once. You do it for 3 trials, actually. And then out of that, you have a score of 15. So 4 for trial 1. If he gets 5 for the next 2, that'd be 14 out of 15. So after that, we do concentration. We'd test at digits backwards. So again, you can do lists from like 3 numbers to like 5. So we'll do 3 numbers just for the sake of time. So we're going to do 3 different lists of numbers. I will give you it twice, and then you repeat it back to me. Okay, ready? 493. 493.
934.
All right. So obviously he didn't have it right, so we would circle no on this score and give him a score of 0 for that one. And then we go down the list. So it goes, there's 2 of 3, and then it goes to 4, and it goes to 5, and it goes to 6 numbers in a list, and then they repeat it backwards. All right. So next we go into months in reverse order. So can you repeat the months to me backwards, please?
December, November, October, September, August, July, June, May, April, March, February, January.
And from my experience, athletes usually have kind of a tough time with this one. Tell them it's okay to start from January, work your way back up, and then repeat it. But as long as he gets all of the correct months in order from reverse, then it'd be fine. So you score that out of 1. So the concentration score, digits are out of a score of 4, and months in reverse order is out of a score of 1 total. For step 4, we will be testing neurological screening. So a bunch of this has been tested previously, but can the patient read aloud? So that would be the concussion symptom score when he was reading aloud to me previously when I gave him it to fill out. That would be a yes or no question. Does the patient have a full range of pain-free passive cervical spine movement? That would be tested based on if he had any pain or tenderness in his neck. So if he did, then we would bring him through a passive motion. If he doesn't experience pain, then that'd be a no. But if he hasn't been complaining of pain in his neck, then we wouldn't have to test this one. So without moving their head or neck, can the patient look side to side and up and down without double vision? When he was reading, he'd move his eyes side to side and up and down. So we would be able to test that one while reading the concussion symptom score sheet. And then the next one we would have to test would be the finger-nose coordination. So bringing his finger from out, so can you follow this, and bring it into your nose, and do that 5 times. So if you would to go off to his cheek or wouldn't be able to focus on bringing his hand in, then that would be a fail. And then tandem gait. So we would stand up and have your non-dominant foot in front or at the back. And then we would bring him down like this and have him walk, just like toe to toe. Good. Perfect. So while we're up here, we're going to test the balance examination. So that would be the MBEST. So first stance would be the double leg stance. You're going to close your eyes, and I would count for 20 seconds, counting any fails. So if I see him wobble or have to step out of his stance, that would be a fail. Single leg stance on your non-dominant foot. Perfect. Same thing, would be testing for any fails or looking for any fails, wobbles, or anything like that. And then the tandem stance with your non-dominant foot in the back. Perfect. And then we would count out the total number of errors out of 30, 10 for each stance. Okay, and step 5, delayed recall. So this should be performed 5 minutes after the immediate recall section. I would repeat the list of words that I read earlier, or have him repeat it back to me. Yeah, so can you repeat back to me the list of words that I told you earlier?
Penny, lemon, insect, pillow.
Okay. Okay, perfect. So that would be out of 5 or out of 10, depending on the list of words that you chose previously. Then step 6 would be the decision. So this would just be totaling up all of those numbers that you had on all of those tests. So if and then dating the time and injury, diagnosing their concussion, and anything like that. So perfect.